G'day folks, we're talking about adult ADHD today. What is it? What do you do about it? And what can potentially go wrong? Check it out.
Okay, and today you're going to teach me about adult ADHD.
I'm going to.
Good.
All right. Okay. So I guess the first thing to get your head around is what is it?
Mm-hmm.
Okay. What is it? And I mean, there's lots of different ideas about it. The way I like to think about it is though it's like an arrest of the normal stages of development that happens in childhood. Okay. So what do I mean by that? Let's consider that kids, they're all hyperactive. Little kids, they're all hyperactive. Yep. Okay. Little kids, they're all inattentive.
Yes.
Okay. And they're all emotionally unstable.
Yes.
Okay. So that's just normal. Nothing wrong with that.
No.
Okay. So there's sort of no such thing as an ADHD 3-year-old because they're all like that.
We don't diagnose it that low.
They're all like that. They're all like that. Okay. But something happens at about the age of 6 where the sort of hyperactivity of young children starts to diminish. Now there's a lot of variation as to how old you are when that happens, but around that sort of mark, the hyperactivity reduces.
Okay.
Okay, no worries. So now you're left with kids that are inattentive and emotionally unstable. Okay. Then around the age of sort of 13, 14, something like that, okay, their inattention starts to improve. They can be more focused. Now, for some kids that happens a lot earlier, for some kids it happens a bit later. Okay. Their inattention diminishes, all right? Now, when that inattention doesn't diminish and say they're sort of 14 or so, that's what sort of looks like an ADHD kid.
Yeah.
Okay. Because they're inattentive.
Would you be starting to pick it up here though if the hyperactivity kind of hasn't gone by 6 and it's still there at kind of 8, then what are kind of red flags? Yeah,
exactly. So whenever these persist, so if the hyperactivity is persisting, that's looking like ADHD, even though it might be normal to be inattentive. Yeah. Okay. Yeah. But then once they're inattentive and hyperactive, it's pretty clear what's going on. All right. Now then, as your maturation continues, we become more emotionally stable. 19, 20, 21. Okay. Not everyone though. There's a lot of people who are very emotionally unstable. That's not so much ADHD. That's more sort of keeping with borderline personality and that kind of thing. Okay. Yeah. But these are sort of the normal maturational kind of milestones. Okay.
But is the emotional instability then kind of a symptom of adult ADHD? BPD in its own right?
I mean, they do tend to co-occur quite often.
Okay.
Okay. So I'm not sure what the correlation is there, but it's it's not unusual to see that.
Okay. That makes sense because I have a lot of I work with BPD and I have a lot of patients that have ADHD and I've never actually put the two together. Okay. All right. Good. Continue.
Okay. So anyways, in other words, the attention systems that the adults are left with are kind of childlike.
Yeah.
And they're easily distracted. Okay. Yeah. Trying to, read something technical and boring is almost impossible.
Yeah.
Okay, it's almost impossible because they're distracted by their thoughts or by what's that sound out there or whatever. They just can't attend. Okay. All right. Why does it happen? Look, who knows exactly? Certainly there is likely to be some kind of genetic cause. Okay. It does tend to run in families. So there's some speculation that it's got to do with this sort of like intergenerational kind of I'm like this, my parenting was like that, my children end up like this sort of intergenerational kind of thing, which may be nurture or nature.
Yeah,
it's not completely clear.
Okay. All right.
But we know that, kids who have, phenomenal stress put on them, trauma, that really kind of thing, trauma, that really predisposes to ADHD. Okay, when they're adults.
Is that any link to kind of this actually, the hyperactivity becomes a hypervigilance?
Don't know. Okay. Obviously, head injuries, again, that's a different kind of stress, a physical stress, prematurity, seizure disorders, all that kind of stuff as well. Okay. They're all, sort of I've said causes here, but it's sort of the predisposing things.
Yeah.
Okay. So you can have all these things and still not have ADHD. You can have none of these things and end up with ADHD. Okay.
Yep.
All right. So what are the consequences? Okay. So we already alluded to it's very difficult for people like adults with ADHD to attend to non-interesting material.
Yes.
Okay. So if you're trying to study at uni and it's something really dry, it's tough. Okay.
And more tough than it is just for kind of normal people. I didn't like my textbooks, but
exactly. So, but it's almost impossible.
Yeah.
Okay. It's almost impossible.
It's more effortful than would be. Normal.
They can do it. There's various tricks. Okay, there's various tricks that you can use to help focus your attention, and we talk about that in one of our other clips. So you might want to check that out.
Already. Yep.
Okay. Cool. Anyways, because of this, it affects your learning.
Yeah, well, if you can't pay attention to the material, then you're not going to be able to absorb the material to recall it later.
Yeah, exactly.
Fair enough.
Okay, it affects your occupational functioning for similar reasons.
Yeah.
Okay, but also just getting stuff done. You can become very distractible. Yeah. In some occupations, it can work well. There are some occupations where you're juggling 10,000 balls. You don't have to do anything and nail it. Like I had a guy who was a foreman. right? So he didn't actually have to kind of like he wasn't like kink on this particular job. He was just sort of had to be more or less across stuff.
Yeah.
And that suited him. He was like all over the shop. Yeah. Right? But that actually worked in that role. So it can work well, okay? And so it's in some occupations, right? Now, anyways, the problem with, not being able to attend to non-interesting material, affecting your school grades, affecting your career options, it can affect your self-view.
Yeah, because we get kids starting to call themselves dumb because they're getting bad grades or labelling themselves as naughty, but it's actually because they've got this going on. Yeah,
exactly. I mean, so I had a chap who thought of himself more or less as illiterate. Okay? Wow. He could read though, but he just couldn't attend. So we started him on some treatment. He read his first book since he was like in primary school or something, right?
Okay. So what does treatment look like?
Okay, treatment. So like I alluded to, there are some sort of tips and tricks that you can utilise, okay? But often people just coming at this cold, they can't even access that kind of stuff, right? They need something a bit more heavyweight before they can start to learn these skills, okay? And a lot of people just rely on the more heavyweight thing, which is the medications.
Right. Yeah. Well. Okay. Yeah. I mean, that's what I suppose would have heard of being primary line of intervention for ADHD. Give them drugs.
Yeah, pretty much. Okay. So and we are restricting ourselves in this conversation to adult ADHD, just to be clear. All right. Okay, so what are the drugs? Look, the drugs are all more or less the same.
Yeah.
Okay? There's variations on the theme, I guess. Okay. But the medications are stimulants. Okay. So in Australia we primarily use Dexamphetamine.
Yeah.
Okay. And methylphenidate, also known as Ritalin.
Okay.
Okay. Then there are slow acting and short acting versions and so forth. Okay. But they're two primary ones we use. Okay. There are some other kind of weird and wonderful things that are sometimes used. All right. I'm not going to get into those. I think that we'll get a bit derailed if we go too far with that.
Okay.
Okay.
So can I ask a question?
Sure.
Why is it when we've already got a system that's kind of hyperactive and inattentive, why do we give them stimulants?
Okay. Lovely. That's kind of the fundamental question.
It does not compute. So please explain.
Okay. Essentially, what's going on is if you think about the let's just concern ourselves with the sort of prefrontal lobe.
Yep.
Okay, that's where our executive function goes on. That's what we use to inhibit our impulses. Okay. So let's say you're sitting down to do some study or whatever. Right?
Yeah.
Okay. But now my mind flitters to, oh, what's that noise out there? And oh, I'm a bit hungry and all this and all that. And you're all over the place. Okay. So you're not able to inhibit all these impulsive things.
If you've got ADHD.
If you've got ADHD.
Right, okay.
So you give someone some stimulant, all right, it improves their frontal lobe function and they get better at inhibiting all those impulses.
Right.
Okay, so they can attend. So you're right, it's kind of paradoxical. If someone's all over the place, okay, why are you giving them this juice that should just turn everything up? It actually turns up the thing that helps you inhibit yourself.
Okay, can I try with a metaphor and you tell me if I'm getting this right? Okay. So if executive functioning is effectively the teacher at the front of a classroom who's going kind of do your work, this is what you're going to do, and the ADHD is kind of the noisy kids, you're actually giving the medication more to the teacher to have better control over the noisy kids? Does that work?
Yeah, I mean, I think it might be a bit confusing because people will think, do you mean dealing with noisy kids? Yeah, it's more like having a couple more teachers controlling everything.
Yeah, okay. All right, yeah, that makes more sense. Okay, all right, good.
All right, so that's how it works. So we got on to here, okay, so stimulant, you take the stimulant. Okay, now the effect that we're going for is this sort of improved frontal lobe function.
Yes.
Okay, so what that will do, all right, is it will create, as we said, it will decrease your distractibility.
Yes.
And that's what gives you improved attention.
Okay.
Okay, that's actually the whole point of taking it.
Yeah.
Okay, from a medical point of view.
Yeah.
All right. Now there's a downside to that as well potentially. It decreases your spontaneity.
Okay.
All right. That's why it decreases hyperactivity.
Yeah.
Okay, so hyperactivity is basically manifested spontaneity.
Yeah.
All right. So it decreases your spontaneity. So you might think, okay, well that's not too bad. The downside of that as well, though, is it can reduce your creativity.
Yeah. Like if you've got people who are kind of artistic, musical, and use their kind of
it can really stifle their creativity.
Yeah. Okay.
And also just things like playfulness. You're less playful.
Yeah.
Because that's there's a lot of spontaneity in play. Right?
Yeah.
So that's kind of that's some of the downsides there of increasing your frontal lobe function to dampen down your kind of impulsivity, if you like. All right, but it comes. Yes, you get more attention, but it can have other costs.
So the teacher inside your head gets a bit stricter.
Yeah.
Okay.
Yeah, so you're not having any fun. All right. Okay. Now, if you overdo it, okay, people end up just feeling quite zombified. Okay. They're so kind of stifled. All right. that they're just not having any fun at all.
Yeah.
Okay, so this is where getting the dose right.
Yeah.
And we'll get a bit more into that. All right, so that's the main function, okay? It's all about that. But I've got these other boxes here, so what's that about? All right, so the other thing a stimulant will do, obviously, is increase your arousal.
But is this increase in the arousal on top of someone who's already aroused?
Potentially.
Yeah, right.
Potentially. Okay, so people can feel quite wired.
Yeah.
Right?
Okay, so they're like a physical agitation sort of thing?
Potentially, yes. That's sort of one of the downsides is people get a lot of restlessness.
Yeah, right. Okay.
Not always, but they can.
Okay.
So increased energy, that sounds good, unless it's restlessness.
Yeah.
Okay. Increased alertness, that sounds good. All right, but if you take it too late in the day, it's going to keep you awake for sure.
Yes. Because we have a paradigm of sleep is a balance between sleep drive and arousal, and if this is increasing your arousal, we're going to get insomnia, surely.
That's right. Okay, so if you're kind of under the effect of stimulant still, good luck trying to get to sleep. All right, now if you overdo the arousal, okay, you end up with a lot of anxiety, okay, and potentially panic.
Yes.
All right, now, so there's actually a couple, I mean, it's funny with and potentially anger as well, right?
Yeah,
okay.
Because it's fight flight, it's the fight
so you're turning up your juice on your arousal, anxiety and anger. And interestingly, improving your frontal lobe function can actually decrease your anxiety and your anger because you're more able to think through things. Okay, so it's kind of got you coming and going a bit here. All right, so some people just find I can't take it; it makes me too angry. All right, okay. Well, fair enough. Yeah. But some people are like, hey, my anger seems better. All right, so it can go either way. It can go either way. It's very individual. All right, so so we've done the frontal lobe, we've done the arousal. Okay, now this is sort of what potentially can get us into trouble. Okay, these medications will directly activate your reward pathways.
Yeah.
All right. So you might think, oh, that's okay. What's wrong with that? Okay. So you get an increase in positive emotion. You feel pretty good when you're taking these things. Okay. And you feel good about what you're doing. Hey, my thinking's really good and I'm feeling really productive.
Look how productive I am.
Yeah. You may not actually be all that much more productive.
But you feel productive.
But you feel productive. Okay. So it increases your positive emotion. And as a result of that, by the way, tends to kill your appetite. All right. Because you're sort of satiated.
Yeah,
so you don't even think about eating.
Yeah.
All right?
Yeah.
Okay, so we've got more positive emotion. Wow, what's wrong with that? It's fantastic. All right. Well, okay, so this is where, if this gets off the kind of rails, all right, this is where addiction can become a problem. All right? Because let's say you don't have any positive emotion in your life. Your life's a train wreck. Okay?
Yeah.
There's every reason to numb the pain, okay, and every reason to seek things to make you feel better. Bing, bing, bing. This will do it. Okay, so that's where people can sometimes get into trouble with addictions.
Yeah.
All right.
And is it addiction to the stimulant then to keep getting that?
Yeah. It's like I have no other source of positive emotion. I feel dreadful when I'm off it. Better have some more.
Yeah.
Okay.
Yeah.
And this is why people abuse meth and all that sort of stuff.
Yeah.
Okay, that's what. So meth is like this. I mean, we'll see a bit later. Methamphetamine is kind of like, it's not all that different to dexamphetamine and so forth, but it's got a way more kick and it's actually quite toxic as well.
Yeah.
Right?
Okay,
thanks. Okay, body effects. Now, it activates your sympathetic nervous system,
it
decreases your parasympathetic nervous system, increased blood pressure, increased heart rate. If you've already got blood pressure problems, not good. So risks increase of things like stroke. Yeah.
Oh, right.
Okay.
Yeah.
Not great. From hemorrhage.
Yeah, not great.
Not great. Yeah. So you kind of want to be, you want to make sure you're in sort of condition that you can handle it, because you get a significant. Some people only get a small bump, like 10 points out of their systolic blood pressure, but some get more. All right, so you really need to
and if you've got kind
check that
anxiety, then that may
that'll
have
feed in
some
as well.
elevations there as well. Yeah, okay,
yeah.
All right.
Obviously, performance enhancement.
Yeah.
Okay, so that's why it's banned in sports, right? Okay.
Yeah, of course.
Okay, because it definitely improves your performance. Okay, one of the ways it probably, it sort of increases your strength and your speed and your agility, everything. Okay, increases your muscle tone to some degree. People get clenching jaws and things.
Yeah,
okay? Probably partly from an increase in arousal and anxiety. Okay, but partly from this too. If you have too much, like when people really go crazy on meth or whatever, okay, they can end up with this increased muscle tone causing increased body temperatures.
Okay.
And that hypothermia and all kinds of sort of complications from that.
Okay.
All right.
Didn't know that one.
Yeah. So that's not So we basically, if you're sensible about the dose, this isn't usually a big deal. But you definitely need to manage some of these things.
Okay.
Okay. You want to know someone's blood pressure before you're starting them on for sure.
Yeah.
Okay. And it's not necessarily a deal breaker. Maybe if they got borderline blood pressure, okay, well, we're going to need to start something for your blood pressure if you want to go on this stuff.
Yeah.
Okay. Now, I hate having to something to another medication to manage. You know, it's not good. But if there's a difference between not being able to perform at work or socially or whatever, then it may be worth it.
Okay, but constant monitoring.
Yeah.
Or frequent monitoring. Yeah.
So that all sounds like good news. So you think, well, problem solved. No worries. Okay, we just take our stimulants and away we go. All right.
Yeah, no.
But there's a problem. There's a problem.
Can you take some?
Yeah, please. Okay. So let's say we start off. I've done these question marks here as like, you know, I'm inattentive. Like what? What's going on? All right. Yeah. So have myself my stimulant. Okay, and up goes my attention. Wow, I'm really attentive now. Yeah. Okay. So hopefully I'm taking this during the day. All right, and I'm nice and activated. All right. I'm not going to get into the slow release stuff just now. I'm just going to keep it simple. All right. Okay. Now, when that wears off, though, all right, you come back to where you were before, plus maybe fractionally lower than where you were to start with.
This looks familiar.
Yeah, from our benzo talk, right?
Yeah.
So, but anyway, it's only a fraction, so who cares? Okay. This is sort of like a tiny withdrawal effect.
Yep.
Okay. So why don't we just segue over to what happens with withdrawal effects of this medication, and we'll come back to you here.
Okay.
Okay, so when you're withdrawing off stimulant, you get basically the opposite of all
that.
this.
Yeah.
So it decreases your attention,
Yep.
it increases your tiredness,
Yep.
it reduces any feelings of positive emotion,
Yep.
and it reduces your performance. Does it feel good?
No, I mean, kind of, if performance down and emotion down, then there'd be an understandable kind of, well, then I need more.
Yeah.
I want more. I want to get rid of this feeling and go back to where I was because that was better.
Yeah, exactly. Okay. So let's come back to, so we've had our dose, our performance and attention and so forth has improved. Now it's nighttime.
Yeah.
No problem. Doesn't matter if our performance and our arousal are down. Some people feel like they have a crash.
Yeah.
Okay. No problem. Helps you sleep.
Yeah.
Okay. Now some people don't get a crash, and it sort of persists a bit longer, and it'll keep them awake.
Yeah.
All right. So there's a lot of variability in how long it lasts in different people. All right. But just in general terms, okay, that's fine. No worries. Okay. And we take it again the next day. All right. It works almost as well as it did the first day.
Okay.
All right.
Yeah.
So we're happy. You know, at daytime we're all functional and great. Wears off. Okay,
A little bit lower.
and again, so if this was our sort of starting point, a little bit lower still, but doesn't matter, it's night time, I'll get a good sleep, new beauty, okay, next day, okay, oh, it's not quite as good. Now I'm exaggerating the time.
Yeah, you are, I mean, it's illustrative.
Yeah, this isn't going to happen over 3 doses.
No.
Okay, but this is the sort of thing that happens. But no worries, okay, it's during the day, fantastic. Okay, there's my come down, but it's night time, who cares? All right.
Okay, doc, it's not working for me as well as it used to.
Yeah, here you go, it's not working. No worries, we know what to do. Okay.
Double your dose.
Double your dose. Okay, so we double your dose and it's working.
Back up to where it was.
Back up to where it was before. No worries. Okay.
And then we get this again, and we get this again.
Yeah, the crash is going to be worse.
Until surely at some point we kind of tap out in a maximum dose, and they go, oh well, kind of not helping
anymore. Just to sort of fast forward to the conclusion, you're exactly right. Okay, so what happens is, you see your doc a couple of months later, oh, I reckon I need a bit more, all right? Or, oh, I've started taking an extra one, is that okay?
Yeah.
All right, yeah, no worries.
Yeah.
The dose creeps up, okay?
Yeah.
This is kind of dose creep. It's because we become more tolerant to the medication.
Yeah.
All right?
Yeah.
So to get the same effect, you need more of it,
Yeah.
okay? Now, why does that matter, okay? Why does that matter? Because you end up having a bigger dose means all this stuff.
Yeah.
Okay, so you come off it, you get big withdrawal effects.
Yeah.
Okay, so I'm not getting much positive emotion. I feel miserable until I get my dose.
Yeah, because your crashes are going to be...
Your crashes are worse.
Wake up in the morning, can't function until I've had my tablet and had time for the tablet to kick in.
Now, this is once the dose has crept up.
Yeah,
so this doesn't usually happen off the bat, okay? This is sort of 6 months in, 12 months in, something like that, okay? All right, so not fantastic, okay? We're stuck with these withdrawal effects, and we're not, and the other thing is, it's not working as well. It's not, can we add something else to it? So how do we avoid this? Because it's look, not everyone, it doesn't seem to happen to everyone, but it certainly seems to happen to a significant
proportion. Well, it's the same thing with benzos. It's kind of, the benzo, it doesn't happen to everyone.
Yeah.
Some people are fine on stable doses for years, and other people get exactly this effect.
So the way I get around this issue, okay. Now I'm not saying you should rush out and talk to your doctor and say, I want to do what Dr. Al said. No. Talk to your doctor about what you think is best for you and get his advice. But when I'm initiating or her, thank you. Okay. But when I'm initiating someone on this medication, what I do is I give them the following advice. I say, take it no more than 5 days in a week. Okay, no more than, because that gives you 2 days to sort of start to reset your kind of brain.
Okay.
All right.
Is it 5 days in a row, or like 2 breaks?
I don't know actually what the optimal is. I generally tell people I want 2 consecutive days off.
Oh, okay. All right. So 5 on, so kind of Monday to Friday, weekend.
I would really like 3 consecutive days off. Yeah. But people have a 5-day working week or study week or whatever, right? So. So I generally say, look, you're gonna cop a bit of withdrawal effect on the days that you're not taking it. All right, that's the way the cookie crumbles. There's no free lunches here.
Yeah.
Okay. So what this curve ends up looking like, all right, if you don't do this, if you don't just keep on taking it every day, so you get to 1, 2, 3. Okay, so here's day 4. Here's day 5. This is greatly exaggerated. Okay? Yeah. Now, you come back up to your sort of baseline state.
Right.
And then you start your week
again. This is the day
again.
where you're skipping.
Yeah, then you start your week again. All right. So it seems, and the other thing I sometimes do with people is I might creep the dose up. So some people say, on the first day it feels really strong, but by the last day it's not strong enough. Okay, well, why don't we take a little bit less on the first day and a little bit more on the last day? Have yourself your couple of days off. Okay, so you reset your tolerance.
Okay.
Okay. Now again, it's got to be individually tailored.
Yeah, you guys need to be talking to your health professionals around this. Like, we're not giving individualized advice or dosing kind of ideas around. Well, we're talking about kind of ideas in theory here, but we're not giving you individualized advice. So you need to be talking to your primary healthcare provider and whoever's prescribing this. Talk to them. Yeah.
So to avoid dose creep, what I suggest to my patients, right, 2 consecutive days off a week. I like you loving my handwriting there, right?
Yeah, I hope you can read that. I'm glad he was narrating as he was writing.
Okay. 2 consecutive days off a week. And the other thing I like them to do is I like them to have 1 full week off, right, every 2 to 3 months.
Okay.
Okay.
So people would have to really kind of plan for this. Like, if they were dependent on it to be able to function at work, that may mean that they're going to take a week off work, or kind of that's their holiday break or whatever, where they can just kind of chill for it.
Yeah. Now, but when people are on holidays, they kind of, it's like, oh, well, I really want to get this done and get that done. So it's not, it's not really, it's not welcome news, right? Okay. And same as the weekend, I want to do this on the weekend, and I do it so much better when I'm taking my stuff. Okay. So look, I mean, if you've got some awesome thing on the weekend and you really need to get it done, okay. Skip your skip doses. Okay, you're potentially asking for tolerance to creep in and thereby dose creep to go up.
Yeah.
All right. Now, like I said, not everyone.
Yeah.
Okay. Plenty of people are on a stable dose for years. Okay. But plenty of people don't, and they're now on these stonkingly high doses.
Okay.
And end up with that.
Yeah.
All right.
Talk to me about the hexagons that you made me draw.
Oh, yeah, okay. All right, the hexagons. Okay, so what the hell are these stimulants that we're taking? Well, that's some people are taking. Yeah. Okay, so what I want to do is, basically a little bit of chemistry here. Okay, so this thing here, noradrenaline. Okay, so we make this.
Naturally occurring.
Occurring. Yep. If you take off
norepinephrine in America.
Norepinephrine, thank you.
Yeah, norepinephrine in the US.
All right, you take off this little oxygen here, and you have dopamine.
Yeah, so it's the same
without
that.
They're so similar. Okay, they're so similar, all right, but have remarkably different effects.
Yeah.
All right. What's dexamphetamine? Okay, well let's add a little line down here, and that's dexamphetamine. So it's almost the same.
That's
as dopamine,
why it's activated, because dopamine's around your reward pathway, so that's where you get the drug to basically replicate the effects of this.
Yeah, it also looks a lot, pretty close to norepinephrine, hence the increased arousal, right? Okay. All right, no worries. All right, what about our nasty fellow, methamphetamine? Not very different too. Add a little line here for an extra carbon. That's methamphetamine.
Yep.
Okay. Now this stuff's super toxic. Okay, it kills your brain cells real good. All right.
Yeah.
Doesn't look all that different, right?
No.
Okay. So little tweaks can make a huge difference to their effect.
Okay. What's this?
This stuff here. So again, if you will look at our dexamphetamine, we'll add another little line here.
Yeah.
Okay, for a carbon. That's duramine or phentermine. All right, which you use a lot in weight loss kind of roles.
Yeah, right, okay. Heard of that one.
In Australia, you don't need sort of special permission, you don't need to have ADHD to get prescribed this.
Really?
But you do to get prescribed that.
So this is authority script?
Well, No, but it needs to be by an authorised prescriber.
Right.
So paediatrician who has the authority, or a psychiatrist who has the authority. Not all of them bother to get the authority, and fair enough. Okay, whereas this one any doctor can prescribe, at least in Australia. Okay, this is okay. So we've kind of. Again, if we compare to dexamphetamine, all right, now we'll just add these blue lines in around here to complete the ring and chuck in a couple of little oxygens and stuff here. That's methylphenidate, which is Ritalin. So it has the same, more or less the same kind of shape with some extra bits.
Yeah.
Okay, so you can see, wow, how similar are all these things to each other?
Yeah, they're pretty closely related.
All right, now, how do you decide whether dexamphetamine is going to be better or Ritalin's going to be better? Okay. You don't know in advance.
Trial and error?
Pretty much.
Okay.
Generally speaking, the Dex is kind of, quote unquote stronger, okay? Per milligram, you probably get more bang for your buck.
And what's like kind of half-life of this stuff in terms of how long the effects will last for?
It's pretty variable, okay? It's something like sort of 4 hours, okay? And this is something like 3 hours, okay?
There's not that much difference
I don't know.
Okay.
I'm not too sure about that one. Good question. I don't prescribe a lot of that.
Okay, all right.
Okay, all right. So this one's a bit faster acting. Some people feel like when it stops working, it's like bang, it's just stopped.
Yeah.
Okay. So you do hear that a bit, but some people actually like that. At the end of your day, boom, it's finished.
So if you know that it works, it lasts for 3 hours for you, then you can schedule your kind of dosing schedule throughout the day of kind of one here and then.
Yeah.
If it's only 3 hours, I'm guessing there's multiple doses throughout the day.
Yeah, that's right. So 3 hours is the half life, but you actually might you probably still be feeling an effect for 5 hours. So.
Yeah.
Depending on the individual.
Yeah, but okay, so we have one at 6 a.m, we have one at midday, you're kind of crashing by 6 p.m-ish, so by 9 o'clock when you go to bed, you should be all right.
They work pretty quick, so most people take them just before they, like, say, 10 or 20 minutes before they sort of need it to work.
Okay.
All right, so...
Rock in work, make your coffee, have your...
Yeah, something like that, okay. So you have yourself your dose, you probably have another dose at lunchtime, okay, and then it'll wear off, and so that way you get home, you're not all wired, you're able to get to sleep. Okay. Now there are, without getting into too much detail, there are long-acting versions of these drugs as well. Okay. Yeah. And some people will absolutely go, it is so different. It's like it's a completely different thing. Like it's the same molecules, right?
Yeah. Okay. But it has a different effect on different people.
Yeah. Yeah. But people will say the same thing between the difference between Dex and Ritalin as well. Like I can't believe how different it is. I mean, I accept that you're feeling that it's pretty different.
Listen, extra bits.
It looks different.
Okay. All right, so take-home message. What do you got?
Okay, so take-home message is we don't want dose creep. Okay, dose creep increases our chance of problems with bodily harm.
Yep.
Essentially. Okay, and look, I mean, the other things that can go awry: addiction, psychosis, getting zombified. This all happens as the dose gets crept up.
Yeah. Okay.
Okay, so we don't want dose creep. How do you avoid dose creep? Take your weekends off. Take a week off every couple of months. All right. That still might necessarily avoid it completely, but it'll slow it down. And
surely there's got to be kind of, okay, maybe ADHD, we can't necessarily say skills before pills, but skills with pills for this one at least?
Yeah, thanks. Yeah, so you can learn some skills to improve your attention.
Yeah.
But you need some attention to do the work. Okay?
Okay,
so there are various attention practices that you can utilise, but if you've got ADHD and you're totally untreated, it's a very tall order.
Okay, all right. We've got another video on that one up on Psych Collective YouTube channel already, so have a look at that. We good?
I think we're good.
Okay. We will probably chuck up a handout on this one on the website because that is a very full board and there's a lot of information up there. So we'll help you out with a handout on the website, psychcollective.com. Find us Instagram, Facebook, YouTube, and we'll see you next time. Thanks, everyone.
Thanks, folks.